Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Rudrok, and in Rudrok, we were discussing how we can diagnose infarct on the basis of principles of Ayurveda. And in that regards, I have told you that you can diagnose it as Siranangranthi or Srotasanga or Srotorod, and the treatment required is to penetrate the obstruction in the blood vessels, so you require Bhedan Karma. I have asked you one question that I have 4 Bhedan Dravya, Kumari, Katuka, Chitra, Segugulu with me. So logically we can use any of these, but still to which Dravya you will give preference first and what is the reason behind that. Now all these Dravya have action of penetration and they can be used in the infant condition, but my choice will be first choice will be Kumari or Katuka. Now what is the reason behind this? In last some of the episodes I have discussed how a dravya works and rules of dravya karokata. So first rule was some work is done by rasa, some by vipak, some by virya, some by guna, and this rule is uh, mainly seen in the samana pratyara dravya. For example, madhu madhushit, guru snigdha. So all these factors will contribute in the action like bruvan, etc. The other rule is vipak is powerful than rasa, virya is powerful than vipak, and prabhav is powerful than rasa, vipak, virya, because it is the supernatural power of that drug. This external power is given by nature to that drug, and that's why prabhav is the most dominant factor of dravya. When I am going to see this Kumari, Katuka, Chitra, Gugulu, you will find that Kumari and Katuka have Bhedan action because of their prabhav, and hence I will give first preference to these two drugs because they are working by their prabhav as a Bhedan dravya. In addition, I will use Chitra or any other drug, there is nothing wrong in that, but my preference will be to use that drug which will have action by a prabhav in that particular disease, and prabhav is supernatural, and hence the answer is Kumari and Katuka should be the first line of treatment. Now the second question is, how will you use Kumari Katuka or any dravya for the Bhedan Karma? Which kalpana? Now we are discussing Rudro. Infarct is in the blood vessels, and nature of the blood vessels of the heart that they are very small in nature, sukshma, and they have now got obstruction as compared to the other arteries like radial artery, ulnar artery, or any arteries in the body. Blood vessels or arteries of the heart are very small one, and they have got infarct, so further it increases the intensity of the disease. So I have to use the kalpana of this dravya which will reach to that smallest arteries of the heart, and hence I will use Asav Kalpana as a first choice of the drug. So why Asav Kalpana? They are Vyavai Vikasi, though they will reach the fast, and also they are Sukshma. So because of all these properties of Asav Kalpana, they will reach the desired site of the heart fast, and I will get better results in a quick interval of time. So I will use Kumari Asav, I will use Katuka Rashtra, I will use Chitrakasav, If not possible, then no problem. You can use Ayurvedic as Katuka is the main drug of Ayurvedic. You can use Chitragari Vati. It is up to you. But my thinking will be, my framework will be, use Dravya which will have more potency like Prabhav, use Dravya which are Bedan Karma, and to reach the fast to the infant level, use the Asavarishta Kalpana. If it is not possible by any means, then use Dravya in a powder form or in a water form. Choice is yours. But always keeping in mind that in any disease, not only heart, you have to reach that desired site as early as possible, and according to you can choose the kalpana in your clinical practice. So hopefully I think the reason behind using this kumari katuka is clear, and the choice of proper kalpana is also clear. Now in clinical practice, I have seen many Vaidya using Arjuna in the case of infant patients. And they use Arjuna Gruta, some use Arjuna Churna, some use Arjuna Rishta. Why? Just because it is Rudya, and so in the case of infant, they are using Arjun without any hesitation. We will discuss this use of Arjun, whether it is really indicated or not, specifically in the case of infant, in the next episode. Thank you very much.